Right, so following on for looking at the foot, this time we're going to look in the instep of the foot. Okay, so that's sort of that arch of the foot, if you like. Now, there's a little muscle that sits in here. It's called your adductor hallucis. Now, attaches to the obviously the calcaneal down here, comes up, only probably comes about midway up. Okay, so probably to the first joint of that large phalanx of the great toe. So we're sort of looking for that bony process here of the phalanx, and it occupies this little space right here. Okay, so obviously it's an abductor of the great toe as well, helps in that abduction. What we'll find is the trigger point for that adductor hallucis is just down in this area here, and it likes to refer up and around this area here. Now, once again, it's one of these muscles. If you're treating foot pain, it will definitely go under the radar because a lot of these superficial intrinsic muscles, because they're covered, and we tend to focus a lot on a lot of the plantar aponeurosis. We're going to focus a little bit more into this medial arch. And once again, it's one of those muscles that's just because it's not taught that much and we're not aware of it, it goes under the radar. Be aware, but this is a muscle that can be quite sensitive. You've got a lot of sensory nerves that come down through here, branch of sensory nerves down here. So sometimes you may get little bits of paresthesia or pins and needles going on, but don't be alarmed. It's not an issue. Like any of these muscles, just a little bit of cream. If you want to start off nice and broad with your technique. So for me, you're going to have your clients in the side lying situation here. Here's your big toe, okay? So if you get your clients to try and push their great toe or their big toe up against you, no, other way, out. So they're going to spread their toes. It's like they're going to spread their toes, okay? Not everyone. And basically what you'll do is that will bring up the bulk of the muscle. So remember, it's only in this portion here. It's not up here. It doesn't go all the way up here. The bulk of the belly of the muscle is down in this area here, okay? So what tools do we use? Well, it depends on your client, depends on the size of their foot. So sometimes you can come in with a bit of a loose fist, depending on how, once again, the position of their foot. You want to make sure it's nice and supported. So broad is always good, as you well know. And we're just going to work through the belly of the muscle here. So I'd spend just a little bit of time just massaging through this area before trying to focus on the actual trigger point itself. All right. You can, and I do sometimes, get my clients just to wiggle their big toe a little bit, just so I can feel the muscle move. Yep, that's it. Beautiful. Thanks, Kath. So just working up and stopping short of that bony process of the phalanx down in that area there. So we're just going to come up, work across. How's that for comfortability? That all right? Now, let's say that I change this up and I'm going to highlight and work the trigger point itself. So I come in with a thumb and a brace thumb, sink in, and we just get to the trigger point, which is around about there. You'll see your client will start to flinch. So you know you're on the area and you know you're on the trigger point. So you need to gauge your pressure back. What will happen sometimes if you go too deep, your client will go into a foot cramp, okay? So we want to avoid that. That's not what we're trying to chase and do. Art of what we do is getting into the comfort zone of our clients and work the tissue so that it's comfortable for them. But at the same time, we're able to make a change. So if you go too deep, yes, you will get a cramp. That's an indicator that you're going too deep. So remember, we're just in this portion here. So just coming in, making sure that your client can feel that it's all right, it's comfortable. That all right, Kath? Yep. So we're just on that threshold there, all right? So I want to just back it off a little bit. Now, obviously, with any of these muscles, you can actually work these muscles yourself. So you can get a bit of a good gauge on how much pressure you can take. But for the most part, once again, it's a big, fleshy, broad muscle. So it's not a small, intricate muscle. So you just got to be mindful, coming in and picking up all the fibers, okay? Right up. Once you hit that bony prominence, you know that's your end point. Coming up through here. We know that the muscle through here is our flexor dig, which we'll talk a little bit later on. But in terms of working this muscle, we're keeping in the medial surface here. And as I said before, you can come in, work a broad angle on it first, get the client used to having the work done on that area. Then you can come down and start using thumbs, but you have to watch your pressure, all right? Very, very important. So that's probably just about enough that Kath can take. As I said, if you're having trouble locating, just get them to wiggle or try and spread their toes, okay? And you'll find the bulk of the muscle will pop up underneath. So just through that area there. Okay, so the belly of the muscle is just through here, okay? So that's what we're looking at. There's the calcaneal down here, so it attaches on that medial surface. Obviously, you want to come up through that area there. So if we're going to come in with a broad approach, once again, through this area, we've got the Brony prominence up here, so that's our stopping point, right through there. That's it right there. Okay, get your clients to wiggle their toes a little bit. That's it. We can feel the area there. So just working through there, and then obviously up through here as well. Done.